Chronic obstructive pulmonary disease, or COPD, is a progressive lung condition that affects millions of people worldwide. Early detection and accurate diagnosis are crucial for managing symptoms and improving quality of life. In this video, we'll explore the most commonly used tests to evaluate COPD, helping you understand what to expect during the diagnostic process. Whether you're a patient, caregiver, or simply interested in respiratory health, this guide will walk you through the essential assessments used by healthcare professionals to diagnose and monitor COPD. Testing for COPD is vital because it allows doctors to confirm the diagnosis, assess the severity of the disease, and monitor its progression over time. Accurate testing ensures that patients receive the right treatment and support. It also helps distinguish COPD from other respiratory conditions that may present with similar symptoms, such as asthma or bronchitis. Understanding the purpose behind each test can help patients feel more comfortable and informed during their medical journey. Spirometry is the most common and essential test for diagnosing COPD. It measures how much air you can inhale and exhale, as well as how quickly you can blow air out of your lungs. During the test, you'll be asked to take a deep breath and blow into a mouthpiece connected to a machine. The results help doctors determine if there is airflow obstruction, which is a hallmark of COPD. Spirometry is simple, non-invasive, and provides valuable information about lung function. Two key measurements from spirometry are FEV1 and FVC. FEV1 stands for forced expiratory volume in 1 second, which is the amount of air you can forcefully exhale in the first second. FVC, or forced vital capacity, is the total amount of air exhaled during the test. The ratio of FEV1 to FVC helps doctors determine the presence and severity of airflow limitation. In COPD, this ratio is typically reduced, indicating obstructed airways. The bronchodilator reversibility test is often performed alongside spirometry. After an initial spirometry test, you'll inhale a bronchodilator medication, which helps open up the airways. Spirometry is then repeated to see if your lung function improves. Significant improvement suggests asthma, while little or no change supports a diagnosis of COPD. This test helps differentiate between similar respiratory conditions and guides appropriate treatment. A chest X-ray is commonly used to rule out other lung problems, such as infections or lung cancer, that can mimic COPD symptoms. While a chest X-ray cannot confirm COPD on its own, it can reveal signs like overinflated lungs or a flattened diaphragm, which are often seen in advanced cases. This imaging test is quick, painless, and provides valuable information for the overall assessment. A computed tomography, CT scan, provides more detailed images of the lungs than a standard X-ray. CT scans can detect emphysema, a common component of COPD, and help assess the extent of lung damage. This test is especially useful when doctors need a clearer picture of the lung structure or are considering surgical options. CT scans are non-invasive but involve a small amount of radiation exposure. Arterial blood gas ABG analysis measures the levels of oxygen and carbon dioxide in your blood. This test is usually performed by taking a small blood sample from an artery, often in the wrist. ABG analysis helps doctors assess how well your lungs are exchanging gases and whether you need supplemental oxygen. It's particularly important in severe cases of COPD or when symptoms worsen suddenly. Pulse oximetry is a simple, non-invasive test that estimates the oxygen saturation level in your blood. A small device, usually clipped to your finger, uses light to measure how much oxygen your red blood cells are carrying. This test is quick and painless, making it useful for routine monitoring of COPD patients, both in clinics and at home. The 6-minute walk test evaluates your exercise tolerance and overall functional status. During this test, you'll be asked to walk back and forth along a hallway for 6 minutes, while your heart rate and oxygen levels are monitored. The distance you can walk in this time provides valuable information about your physical capacity and how COPD affects your daily life. It's a practical way to assess the impact of the disease and track changes over time. Some cases of COPD are caused by a genetic condition called alpha-1 antitrypsin deficiency. A blood test can check for this deficiency, especially in younger patients or those with a family history of lung disease. Identifying this genetic factor is important because it may influence treatment decisions and alert family members to their own risk. Peak flow measurement is a simple test that measures how fast you can blow air out of your lungs. While it's more commonly used in asthma management, it can also provide useful information in COPD, especially for monitoring changes in airway obstruction. The test involves blowing into a handheld device called a peak flow meter, and the results can help track your lung function over time. Lung volume tests, such as body plethysmography, measure the total amount of air your lungs can hold. These tests provide detailed information about lung capacity and can help distinguish COPD from other lung diseases. They are especially useful when spirometry results are unclear or when more precise measurements are needed for treatment planning. The diffusing capacity test, also known as DLCO, measures how well oxygen passes from your lungs into your blood. This test involves inhaling a small amount of gas and then exhaling, with the machine analyzing how much gas is absorbed. Reduced diffusing capacity is common in COPD, especially when emphysema is present. This test helps doctors understand the extent of lung damage and tailor treatment accordingly. Although not directly used to diagnose COPD, allergy testing can help identify triggers that worsen respiratory symptoms. Allergies can complicate COPD management, so knowing your sensitivities can be valuable for avoiding flare-ups and improving overall lung health. A sputum examination involves analyzing a sample of mucus coughed up from the lungs. This test can help detect infections or other conditions that may be contributing to COPD symptoms. Identifying bacteria or other pathogens allows doctors to prescribe targeted treatments and prevent complications. An electrocardiogram, or ECG, records the electrical activity of your heart. COPD can sometimes affect heart function, so an ECG may be performed to rule out heart problems that could be causing or worsening symptoms. This test is quick, painless, and provides important information about your overall health. An echocardiogram uses ultrasound waves to create images of your heart. This test can detect heart problems that may be related to COPD, such as pulmonary hypertension. It's non-invasive and helps doctors assess how well your heart is pumping and whether there are any complications affecting your lungs. Blood tests can measure markers of inflammation, such as C-reactive protein, CRP, or white blood cell count. Elevated levels may indicate an infection or an exacerbation of COPD. Monitoring these markers helps doctors decide when additional treatment is needed and track the effectiveness of therapy. Pulmonary function tests, or PFTs, are a group of tests that measure how well your lungs work. They include spirometry, lung volume measurement, and diffusing capacity tests. PFTs provide a comprehensive assessment of lung function and are essential for diagnosing and monitoring COPD. These tests are usually performed in a hospital or specialized clinic. Continuous monitoring of oxygen saturation can be important for patients with advanced COPD. Devices like portable pulse oximeters allow for regular checks at home, helping patients and doctors adjust oxygen therapy as needed. This ongoing monitoring supports better symptom control and reduces the risk of complications. Exercise testing, such as treadmill or stationary bike tests, evaluates how your lungs and heart respond to physical activity. These tests help determine your exercise capacity, identify limitations, and guide rehabilitation programs. They are particularly useful for tailoring exercise plans and monitoring progress in COPD management. Sleep studies, or polysomnography, may be recommended for COPD patients who experience sleep disturbances or symptoms of sleep apnea. These tests monitor breathing, oxygen levels, and heart activity during sleep. Identifying sleep-related issues is important for comprehensive COPD management and improving overall quality of life. The FeNO test measures the amount of nitric oxide in your exhaled breath. While it's mainly used to assess airway inflammation in asthma, it can sometimes help differentiate between asthma and COPD. This non-invasive test provides additional information about airway inflammation and helps guide treatment decisions. The methacillin challenge test is used to assess airway hyperresponsiveness. You'll inhale increasing doses of methacillin, a substance that can cause airway narrowing. Spirometry is performed after each dose to measure any changes in lung function. This test is mainly used to rule out asthma when the diagnosis is unclear. Cardiopulmonary exercise testing, CPET, combines measurements of heart and lung function during exercise. This comprehensive test helps determine the cause of exercise limitation and guides rehabilitation strategies. CPET is especially useful for complex cases where multiple factors may be affecting breathing and physical performance. The BODE index is a scoring system that predicts the risk of death from COPD. It combines 4 factors: body mass index B, airflow obstruction O, dyspnea D, and exercise capacity E. By evaluating these components, doctors can better understand disease severity and guide treatment planning. Quality of life questionnaires, such as the St. George's Respiratory Questionnaire, SGRQ, or COPD Assessment Test, CAT, help evaluate how COPD affects your daily activities and well-being. These tools provide valuable insight into symptom burden and guide adjustments in treatment to improve overall quality of life. During a COPD exacerbation, additional tests may be needed to identify triggers and assess the severity of the episode. These can include blood tests, sputum analysis, chest x-rays, and arterial blood gas analysis. Prompt assessment ensures timely treatment and reduces the risk of complications. Checking immunization status is important for COPD patients, as respiratory infections can worsen symptoms. Vaccines for influenza and pneumococcus are recommended to reduce the risk of complications. Your doctor may review your vaccination history and suggest updates as part of your COPD management plan. Nutritional assessment is important in COPD because weight loss and muscle wasting can worsen symptoms and reduce quality of life. Dietitians may evaluate your nutritional status and recommend dietary changes or supplements to support your overall health and energy levels. Living with COPD can affect mental health, leading to anxiety or depression. Psychological evaluation helps identify these issues so that appropriate support and treatment can be provided. Addressing mental health is a key part of comprehensive COPD care. Assessing smoking status is essential in COPD evaluation, as smoking is the leading cause of the disease. Doctors will ask about your smoking history and provide resources to help you quit if needed. Smoking cessation is the most effective way to slow disease progression and improve outcomes. Doctors may ask about your exposure to environmental pollutants, such as dust, chemicals, or secondhand smoke. Identifying and reducing these exposures can help manage COPD symptoms and prevent further lung damage. A detailed family history can reveal genetic factors that increase the risk of COPD. This information helps doctors identify patients who may benefit from genetic testing or early intervention, especially if there is a history of lung disease in close relatives. A thorough physical examination is a key part of COPD evaluation. Doctors will listen to your lungs, check for signs of breathing difficulty, and look for physical changes such as barrel, chest, or use of accessory muscles. This hands-on assessment provides important clues about disease severity and overall health. Doctors will ask detailed questions about your symptoms, such as cough, shortness of breath, and sputum production. Understanding the pattern and severity of symptoms helps guide further testing and tailor treatment to your specific needs. A review of your current medications helps ensure that your treatment plan is safe and effective. Doctors will check for potential drug interactions and make adjustments as needed to optimize your COPD management. COPD often occurs alongside other health conditions, such as heart disease, diabetes, or osteoporosis. Assessing for comorbidities ensures that all aspects of your health are addressed and that your treatment plan is comprehensive. Doctors will review your previous test results to track changes in your lung function and overall health. Comparing past and current data helps identify trends, assess treatment effectiveness, and make informed decisions about your care. Assessing your understanding of COPD and its management is important for successful treatment. Doctors and nurses may ask about your knowledge of medications, inhaler technique, and lifestyle changes. Education empowers you to take an active role in your care and achieve better outcomes. Pulmonary rehabilitation programs are tailored to each patient's needs. Assessment includes evaluating exercise capacity, symptoms, and psychological status. This comprehensive approach helps design effective rehab plans that improve physical function and quality of life. Evaluating your social support network is important, as strong support can improve coping and adherence to treatment. Doctors may ask about family, friends, and community resources to ensure you have the help you need throughout your COPD journey. In some cases, advanced diagnostic tests, such as bronchoscopy or genetic testing, may be recommended. These tests provide detailed information about lung structure, function, or genetic factors, helping to clarify complex cases and guide personalized treatment. In summary, a wide range of tests are used to evaluate COPD, each providing unique insights into lung function, overall health, and disease impact. Understanding these tests can help you feel more prepared and confident as you navigate your COPD journey. Always consult your healthcare provider to determine which tests are right for you and to develop a personalized management plan that meets your needs.